Why does breathing life cost nothing, but breathing your last can break the bank? Can you imagine rushing to save a life, only to be charged for the parking spot? Welcome to our eye-opening exploration of 14 things that cost a lot of money but should be free. Here we'll unravel some everyday absurdities that dig deep into our pockets when they shouldn't. If you're ready to challenge the status quo, then join us on this journey of questioning the costly norms of society. Number 14. Feminine hygiene products. Now, let's discuss something every woman deals with: the cost of feminine hygiene products. Pads, tampons, and other period supplies are necessities, not luxuries. Yet, here we are, treating them like optional extras. Every month, it's another item to budget for. And for those struggling to make ends meet, this luxury can be a real financial hit. Some places have started to get it right, providing these products for free in schools, shelters, and public restrooms. It's about dignity, fairness, and health. No one should have to fork over cash for these basic essentials. Number 13. Education. So, you want to get an education to better your chances in life. But the sticker shock of college tuition can make you think twice. We're talking about a system where getting a degree can leave you drowning in debt for years. In other parts of the world, students can get a higher education without the mountain of loans hanging over their heads. They walk off the graduation stage ready to conquer the world, not dodging calls from debt collectors. Number 12. Divorce. Going through a divorce is tough enough with all the emotional baggage, but the financial strain? That's like adding salt to the wound. Lawyers' fees, court costs, and all the paperwork can burn a hole in your wallet faster than you can say irreconcilable differences. And often, it's not just your savings on the line, it's your future financial stability. The process is designed to be as painful financially as it is emotionally. Number 11. Healthcare. Healthcare should be about getting better, not getting worried about how you'll pay for it. But these days, it feels like you need a rainy day fund just for the doctor's visits. Even with insurance, you might find yourself with a bill through the roof. Deductibles, co-pays, premiums. The costs are enough to make your head spin. And if you don't have insurance, you might find yourself choosing between health and other essentials like rent. Number 10. Therapy. Getting therapy shouldn't be a luxury. It's a tough spot to be in, needing to talk to someone about your mental health and then finding out the cost is more than your weekly grocery budget. For a lot of folks, therapy sessions are out of reach, and it's not like you can just put your mental health on the back burner. We're in an era where the conversation around mental health is finally opening up, but the doors to the therapist's office, not so much. We need to make sure support for mental well-being is accessible to everyone, not just those who can afford it. Number 9. Ambulance rides. When you're in an emergency, the last thing you should worry about is how much the ambulance ride will cost. But in reality, that ride to the hospital can leave you with a more shocking bill than the emergency itself. We're talking thousands of dollars for a single trip. And if your insurance doesn't cover it, that's on you. It's a wild thought that, in some cases, people are scared to call an ambulance because of the cost. That's a choice no one should have to make. Emergency medical services are there to help, not to add financial insult to injury. Number 8. Dental plan. Dental health is no joke. It's linked to heart health, diabetes, and even pregnancy outcomes. But when it comes to insurance, dental plans are like the forgotten stepchild. You get your health insurance through your job, but dental? That's extra. And even if you do pay for it, the coverage is often so limited. Basic care might be covered, but if you need anything more complex than a cleaning, prepare for a hefty bill. It's like they're saying that teeth are optional. We need a shift in perspective, where dental health is not seen as a bonus, but as an essential part of our overall health. Number 7. Air at the gas station. So when you pull into the gas station, your tires are a little flat. Air should be free, right? But wait, you're hit with a charge for pumping air. It's not like it used to be. Back in the day, gas stations would give air and water for free as a courtesy. Now, it's $1 or $2 just to get your tires safe for the road. And if you don't have the right change? Good luck. In some places, laws have been passed requiring free air and water, but they're few and far between. It's about time we bring back the good old days when air at the gas station doesn't mean air in your wallet. Number 6. Insulin. Now, onto insulin, a drug that's nothing short of a miracle for those with diabetes. But here's the kicker. The price has been so high that some people have had to risk their lives, rationing doses to make ends meet. It's a dire choice between managing your blood sugar or paying your rent. Sure, we've seen some companies capping prices, but the question remains, why isn't such a critical medication free? With the technology and resources available today, ensuring that no one has to go without their insulin should be a no-brainer. It's a matter of life and death, and it's time we treat it that way. Number 5. Tax preparation and filing. Let's talk about taxes. They're as inevitable as the sunrise, but way less pleasant. In the US, it's like you need a degree to understand tax codes. And if you don't want to risk messing up and facing the IRS, you end up paying someone else to deal with it. It's a weird loop. The government could tell you what you owe, but instead, they let you play the guessing game. And if you guess wrong, you might get hit with fines or audits. Some companies profit big from this complicated system, while the average Joe loses time and money. Number 4. College transcripts. You'd think after paying for tuition, books, and those late-night coffee runs to study, your college would hand over your transcripts for free. But no, there's a fee for that piece of paper too. It doesn't matter if it's your first copy or a replacement, you're shelling out cash every time. And if you need it fast, that's going to cost extra. It's not just about the money either, it's the principle. These transcripts are proof of your hard work, and yet, students are nickel and dimed to access them. It's high time for a change where students aren't charged again for their achievements. Number 3. Professional athletic stadium. And about those huge stadiums. Your tax dollars are hard at work there, and yet, the community's use of them is limited. Consider it. Local schools could hold their graduations in these stadiums, or amateur sports leagues could experience playing on a professional field. But no, these places often stay empty unless there's a major event. And let's not forget, when these stadiums are upgraded or repaired, who do you think foots the bill again? Yep, you guessed it, the taxpayers. Number 2. Hospital parking for doctors. Now, let's dive into hospital parking. Did you know some doctors and nurses work shifts that can last up to 12 hours or more? After a marathon of saving lives and caring for the sick, they walk out to a parking ticket. It's a slap in the face after a day of hard, life-saving work. And it's not just the medical staff. Patients and their families are already dealing with enough emotional and financial stress. Tacking on parking fees, that just doesn't sit right. Number 1. Dying. The cost of dying is a real kicker, you know. Funerals can set a family back thousands of dollars. We're talking about the whole 9 yards: the casket, the service, the hearse, the plot. And let's not even start on the headstone. It's as if saying goodbye isn't hard enough. The price tags on these final farewells add stress. And cremation? It might be cheaper, but it's still a hefty sum out of pocket. It seems odd that something as certain as death comes with such an uncertain and unaffordable cost. Shouldn't we seek ways to ease the burden during such a tough time? And that wraps up our rundown. If you think it's high time for a change, drop a like and spark a conversation in the comments. Don't forget to subscribe for more content that gets you thinking. Let's keep the dialogue going and make a difference together.